As businesses reopen, making sure there is adequate testing becomes even more critical. CBS 4's Jim DeFede spoke to the state's emergency management director, Jared Moskowitz, about plans to dramatically expand testing.
But there also continues to be nagging questions about the availability of face masks and gowns for frontline workers.
There is no emergency management director out there today that needs something that they have not gotten from the Division of Emergency Management. 10 million masks to long-term care facilities. If there are folks in those long-term care facilities that need PPE, we'll send it to them. That being said, it's also possible that there's PPE there, and that might be an internal issue. Hospitals. We have sent more PPE to hospitals than many other states. We have not said to the hospitals, oh, just go on your own supply lines, even though we know from federal documents, there are tens of millions of masks and gowns that have been sent to the hospitals here.
Well, let me interrupt you there.
Sure.
Why am I still hearing from doctors, in Jackson, at UM, at other facilities, that they're having to wear the same mask for 3 or 4 days in a row? That there isn't enough PPE under the emergency guidelines that were set up, but not for normal conditions. Can we really say that we have enough PPE until doctors can start and nurses start using the PPE, like the face masks and the gowns, the way they used to use them?
Yeah, Jim, I can't comment, on these one-off situations. I mean, I don't know what the internal protocols or procedures that have been set at Jackson or any other hospital. Obviously, we send stuff to the county emergency management directors, or we send stuff directly to the hospitals, or we send stuff directly to the long-term care facilities. The federal government just pushed 2 weeks of PPE to all of the nursing homes directly to them. What internal protocols they come up with on their own to figure out, how, is it a mask every day? Is it a mask every 2 days? That's for those administrators to come up with. The state doesn't step in and micromanage that.
Is it acceptable that a doctor or nurse has to wear the same mask for 3 or 4 days in a row?
So the answer to that, Jim, is depends on the situation, right? So if you're in the ICU, no, not acceptable. Okay. If you're in the nursing home and you don't have any COVID there, but you're wearing a mask just as a precaution, yeah, that could be okay. Right. Everyone in the public right now is not throwing their masks away. They're wearing their masks for a couple of days or maybe even for a week. So this idea that everybody in the public is only going to wear their mask once into Publix and then they go home and throw their mask out, nobody is doing that. And there's no evidence that they need to do that. But if you're getting exposed to people on a day-to-day basis with COVID and you're doing, complicated procedures and there's liquids that are coming at you, then yes, you need a new mask after every single solitary procedure.
You have greater testing capacity than you have people coming forward to be tested. Why do you believe that is?
So that's a great question, Jim. So obviously, we first opened up all these huge drive-through testing sites. We have, 15 of them now. We then wanted to make sure that we were opening up sites in underserved areas. And so we then opened up walk-ups. We have a number of new walk-ups opening up, this week, one in Miramar, one in Lauderhill, one in Opelika opened. But as we now get back to society, and as people are no longer stuck in their house and going and getting tested for, sitting in line for 3 or 4 hours is now a daily activity, I do believe we have to make testing more accessible for their everyday life. And so while it's very early, I don't have any announcements. There's a lot of stuff to work out. I do think we should be exploring ways to partner with folks like a Publix or a Home Depot and have testing sites right there. Before you walk in, you can get tested. After you walk out, you can get tested. It's right there. It's acceptable. Maybe putting testing at the dollar store, serving, making sure that we're serving all different populations. Maybe you do partner with a church and you do testing before Sunday services, right? We want to make sure that we're bringing testing to folks. It is true that we have a greater capacity to test than we are testing, meaning that based on the amount of collection kits that we have and the amount of labs that we have contracts with and the amount of people that are coming to the current sites, we can be testing more people than are currently going there, which is why I'm looking to continue to change the mode of testing. It's why we're going to go to all of the nursing homes in the next 3 weeks and test all of the staff members in partnership with DOH and ACA to make sure that we are going to them so that testing is accessible.
You can see more of Jim's interview with Jared Moskowitz this week on Facing South Florida. That's Sunday morning at 11:30 right here on CBS 4.